Hello, welcome to my YouTube channel SD Nursing Classes and Exam Preparations. Today our topic is 4 phases of therapeutic communications. So, let's start the topic. We will see the phases of therapeutic communications. How many phases are there? So, there are 4 phases. Pre-interaction phase, then introductory phase, then working phase, and last is what? That is terminations phase. So, what happened in this phase? First one is the pre-introduction phase, means this is the phase before meeting to the patient, which things the nurse is knowing about the patient, that yes, this patient will come to hospital. So, for that, what all preparation the nurse may do for the patient. This is the preparation stage before the first meeting. Then professional gathers information about the patient and plan for the interaction. It's time for the professional to address their own anxiety and prepare for the relationship. Yes, in this time what happens? The nurse is not knowing anything about the patient and she is just gathering information. Gathering information about the patient, and what happened, without knowing the patient, how the nurse will deal with him. So there may be anxiety or any type of issue may there. So she has to address that. She has to keep aside that and think about the patient, prepare for the patient meeting. So this is the pre-interaction phase, means before meeting to the patient. Before meeting to the patient. Meeting to the patient. So this is what? This is the first phase where the professionals gather all the informations about the patient and she should have the she should make his mind strong that I have to meet to the patient tomorrow morning. So these things is what? This is the pre-interaction phase before meeting to the patient. Only the information you are knowing, but still you didn't meet to the patient. Second is what? That is the introductory phase, means introduction. Yes, patient came to the hospital. So this is practically you are meeting to the patient, introductory phase. They have the meet for first time. In this phase what happened? They meet first time together, and what happened? The professional introduce themselves and establish a relationship. Yes, what happened here? The patient, when the patient came, whom that the in charge professionals, means in charge nurse, she will go to the patient and give her introductions, and I am the nurse who appointed for you, so I will take care of you. My name is like that, and tell me about yourself, like that. They both introduce to each other, and they will make a goal. They will set a goal for their treatment and for the all the plan and goal. They will make a goal to make the treatment. So this is the second phase, which all things the patient, the nurse is going to do for the patient. Everything she discussed, and but with a limit. Boundaries should be always there. So she should not forget that she is a nurse and the patient. In between them there is a professional relationship, therapeutic relationship. So that she should be always remain in mind. And then this is the introductory phase. They both introduce each other, and nurse specially introduce herself to the patient and what their goals for the treatment, everything they discussed. And third is the what? This is the working phase, and this is very important phase. What happened? The plan has been executed and it started work. So the patient, the nurse give the nurse started giving care to the patient. This is the main phase where the patient can have the expectation towards the nurse that yes, my treatment has been started, yes, then when I will go to home, when I will be cured. So this is the third phase. There are so many challenges may come, like resistance, transference, counter transference may be addressed during this time. So if by seeing the patient, there are so many things may come. So that things negatively or positively, we have to avoid that. Means transference means what? What happened with the nurse? She is just seeing the person and thinking about that the past she is bringing to present. Means if she is just thinking about her ex-boyfriend or something like that, so that thing she is seeing in the patient. And the counter transference means what? By thinking that, by all that emotions and the validation she is just showing to the patient. So these all things should be what? Addressed. We have to address all these things and give importance for the patient's treatment. So this is what? This is come problem solving, helping the patients to develop more constructive coping mechanisms. So all these things may come. Means problem solving, we discuss the problem, what is the patient's problem, what is patient's requirement, how the patient feel comfortable. So we have to, everything we have to keep in mind and give him a perfect treatment, perfect environment and comfortable space. So these all things will be happen here. Constructive and coping mechanism, yes, we have to cope with the patient. So this is the third phase. Means this is the very important phase. Everything we decide with the patient, as well as we which your care plan we have to give to the patient. We make constructive to the patient, encourage the patient for some task, and that is totally involvement. Means totally the therapeutic communication being very strong in the third phase. That is the working phase. And last is what? Termination phase. This is the last phase when the patient get discharged. When the patient gets discharged. So this is the fourth phase when your goal, your plan has been approved and your plan has been done. So everything has been completed. So in this phase what happened is finally the patient is recovered and going to the home. So this is the fourth phase. Okay, where what happened? There may be a, because of their involvement has been strong involvement, and because of their strong therapeutic relationship, so everything is gonna be end here. And finally this may be a situation of grief, yes, sorrow. So there, because of that much day patient stayed in hospital and one person giving care to the patient, means she is like a family member to the patient. So obviously the relationship, the attachment will be deep. So that's why what happened, the patient may feel grief, your nurse may feel sad for the patient, and finally they decided for their finally what happened, the patient make understand to the patient, the nurse may make understand to the patient and his family that this type of medication you have to do, this after 15 days come for daily checkup, daily routines. So this type of discussion may occur in this last stage. And this is the something little bit emotional phase, that is termination phase. So these all are what? This is the 4 phases in the therapeutic communications. First one is the pre-introductions, means before meeting to the patients, what all information we can gather about the patient. And second is what? When we meet to the patient, we introduce ourselves, we will tell about him all the goals and all his treatment plan to the patient. And third is what? That is the working phase. That is the very important phase where that will be too longer and where the patient and nurse relationship will be built strongly, as well as the nurse make patient very productive and help him cope him for everything. And third is what? Termination phase, means that is the last phase where the patient will go to his home. That will be something emotional, something sadful situations for both the nurse and the patient. But nurse will make him understand that yes, these all medicine you have to take and follow-up checkup, please come. So the patient also may say that please, when I'll come to hospital, please meet me. So this type of conversations may occur in termination phase. Phases of therapeutic communications. So if there are any doubt, any confusion, please give me in comment sections right there. I will see and tell you about the solution. If there are any type of beneficial you are feeling, please do like and subscribe to my channel, and don't forget to click the bell icon. Thank you.